During the third wave, for the people who unfortunately got infected, 98% were unvaccinated. Of the many who unfortunately died, only 2 were fully vaccinated, but they even had other disease conditions that made them succumb to the disease. So I entreat all persons who are 15 years and above to go to the nearest health facility or vaccination center to get vaccinated. I am fully vaccinated and I'm happy that I took that vaccine. Remember to wear your face mask, frequently wash your hands with soap and running water, use alcohol-based hand sanitizer, and ensure physical distance. Note, we are not safe until all eligible persons are vaccinated. Protect yourself, protect your family, protect the nation by getting vaccinated against COVID-19.
Wacho mi dinse vodu yawo wa mi tama genya ge COVID-19 eye COVID-19 to find eba won yo gbo ka segbe ne fo afaba ni genya ge COVID-19 to find eba doji to fa kome ne ba nye buoi ne fo afaba ina mi se wa ge to find ni gbueko o mi tani nye mefe mo fi am agbueko mi gbu iji egeje ni ge la na mi ni ko be to nji egeje ni ga omo ko gbu ele gbogo ni mo te mi ngbu o mo fi amo obo mo de ni o agbu nyeme ni ya ni o ya ila chamo ni benke ni enu ni nya agbu COVID-19 to fane eku keji oye afi ni maganu mo ke ya o ba nyo ogbu ni ke to fane eku ni kenya ke da gbe o mo de ndo ke face mask e abu ogu da every day anytime sando nyobu for the form kesamna yenuni ho shishi ko na anu wanyo ke sanitizer ashishi wode dele anye ne komo yene ge ilani age wogabua shi baba wo fe wote inyeme ke nwokume nyele anye ne komo nyawa wagbua to fanego amlone no.
My name is Edward Nanapukwose, popularly known as Hammer of the Last Two, and I survived COVID. I'm the last person I expected to catch COVID because I was super careful. I wore masks, I was careful in the beginning during the lockdown, and when I come back from town, I undress at my door and enter my house with my singlet and boxers. I did everything that needed to be done to prevent this disease. And there were a few times I was being interviewed in a radio station that I removed my mask. And I fear that was when I exposed myself to the disease. Now, I believe because I wasn't vaccinated, I got hit very, very hard with one of the most serious cases of the COVID. I was bedridden for a month. I was on 12 cylinders of oxygen before my saturation was stabilized. I got the worst of COVID and nearly lost my life. I think that I am so lucky to be here today to talk about this. Later on, I came to find out that what the vaccine would have done to me, to help me, was actually help me fight.
Hello, good morning.
Disease. It would have created antibodies.
Good morning.
To help me battle.
I know some of you are tired.
I wasn't vaccinated.
You came very early.
So I was knocked very hard.
On behalf of the Director General, we apologize for the delay in starting. So please, let's move forward. We want to start the program. Thank you very much. Once again, on behalf of the Director General, I would like to welcome you to the 6th National COVID-19 Vaccination Campaign. Before we start with an opening prayer, let me invite our dignitaries to come and take up their seat. We have Mr. John Bauer from PAF. Please let's welcome them with a round of applause. We have Dr. Franklin Esiedubekoe, who is the Director, Public Health Division of the Canal Service. Dr. Lisbeth Juma from the WHO Country Office, representing the country rep. Please let's welcome them with them. We have Mr. Fiak Makasi, who is the UNICEF country rep. Then we have the Director General of the Canal Service, Dr. Patrick Kuma Aboaji, who is chairing this briefing for us. Once again, let me welcome all of you, and I'll invite Madam Nelly to give us the opening prayer. Please, let's welcome her with a round of applause.
Thank you, Jacob. Please, shall we pray? Almighty Father, the creator of all things, Alpha and Omega, if you are here this morning, it's because of your sustaining grace and mercies. And all that we want to say is, we thank you, we celebrate you, we glorify thee and honor thee. We commit this morning programs into your hands. Our prayer is that you take absolute control so that we bring it to a perfect end. We commit each and every one here into your hands. All those who are going to pray, oh Lord, you give them retentive memory. You anoint them with your grace. And we commit the media especially, oh Lord, that they will be able to report the accurate information. We pray this in the mighty name of our Lord Jesus. Amen.
Amen. Thank you very much, Madam Nelisi. I would also like to introduce some other people who are here with us. We have Dr. Kwame Amponsa Achiano, who is the EPI Program Manager. Thank you. We have Mr. Hamza Ismaila, who is a Deputy Director at the Human Resource. Then from the UNICEF Country Office, apart from the country rep, we have Dr. Shitie and team. Thank you, all UNICEF team. Thank you for coming. Then from the WHO Country Office, we have Fred and team. Thank you all for coming. Today, we also have some social media influencers in our midst. We have Mr. Stephen Mensah, who is on Twitter. They have been supporting us in this COVID-19 vaccination. We have Tonia Mania, also an influencer. Thank you for coming. Then we have satisfied clients. They've taken the vaccine and they are here to share some of the experiences with us. We have Mr. Ben Raphael Ajay, who is an Uber driver. We have Madam Lucy Pra, who is a hairdresser. And we have you media also here. Thank you all for coming. So I'll hand over the microphone to the Director General, Dr. Patrick Kuma Aboaji, to formally welcome us to this briefing. Please, let's give him a round of applause.
Thank you very much, Jacob. Good morning, and once again, a big apology for the delay in joining you. Our work is such that sometimes you wake up and you don't know the next hour where you'll be in terms of work, because once the work calls, you need to follow. So grateful that you're all here. And so the director, the rep of UNICEF, representative from WHO, Director Public Health, rep from the PATH Ghana, our media influencers, our satisfied clients, our esteemed media, welcome for this meeting. Since March 2020, when the COVID struck in Ghana, we have as stakeholders worked together in concert to ensure that we mitigate the effects of the pandemic on our lives and livelihoods. And I must say here that the role the media played was very instrumental in ensuring that we acted faster, we acted in the interest of the people, and we made sure, because we know we're being watched, it also motivated us to do more than we would have done. And so we need to give you a hand for the work we've done so far and continue to do. Together we have crossed bridges of fear and anxiety, mending our fences of disinformation and the misinformation about disease, forged synergies to ensure that a continuous delivery of healthcare services were rendered. And here, one of the greatest danger was the fact that we would have focused so much on COVID that we would have left other essential services afloat. But fortunately, with your support and that of partners, we were able to carry both the two together to achieve some relatively stable essential service environment in the country. Your respective roles as the fourth estate of the realm has been more than significant and impactful in this fight. And I want to use this opportunity and on behalf of the Ministry of Health, Ghana Health Service and partners to thank you sincerely for walking the journey with us, even though the journey is not yet over. Despite these significant strides, we have chalked together over the past years. Significant strides we have chalked together over the past years. It is regrettable to note that we are still not out of the woods yet. COVID-19 is still with us, calling for rekindling our strategic partnership to reach a more significant proportion of the vaccine-eligible population that remains unvaccinated. To this end, ladies and gentlemen of the media, we have invited you here this morning, the sixth time in a series, to witness the launch of yet another round of National COVID-19 Vaccination Days campaign. You would recall that as part of our strategy to intensify vaccine uptake, the Ministry of Health and Ghana Health Service and its partners launched the National COVID-19 Vaccination Campaign Days in February 2022. Since then, 5 series of these campaigns have been held across all districts in the country, moving the total number of vaccine administered doses from 13.3 million as at the end of April 2022 to 22.6 million doses as at 13th of January this year. Persons receive at least one dose currently stand at 70.6% of the 18.2 million targeted population, while 54% of the targeted population have been fully vaccinated. That they've had 2 shots of the vaccine. And for those who took Johnson & Johnson, they are also fully vaccinated. A little over 3 million persons have meanwhile received booster doses. And that's a number we need to continue to improve. Despite these strides, the cause of the disease continues to evolve, and we still have a significantly large proportion of the population being unvaccinated, especially in the rural areas and areas where the disease seems not to have touched so much. So the fear and the need to vaccinate is not as urgent as those who have seen cases. Consequently, we have gathered here this morning to witness the launch of yet another series of National COVID-19 Vaccination Days, which starts tomorrow, Friday, the 20th of January, through to Tuesday, 24th of January, across all districts in the country. As with the previous campaigns, we're going to have 6,000 vaccination teams will be deployed across the length and breadth of this country, employing both the static, that is facility-based, close-to-client strategies, that is taking the vaccine to them, to reach the unreached, and even going to overbanks to reach people who live across rivers. The aim is to administer about 1.5 million doses, bringing us closer to herd immunity. The role of the media has always remained important before, during, and after these campaigns. And as always, we are counting on you to help us drum home the message that the time to get vaccination is now, especially as there are reported surges in a number of countries across the globe and even around our neighbors. The vaccination remains the most effective way of protecting against the COVID-19 disease, and that COVID-19 vaccines, which are safe, effective, and free. It prevents illness and hospitalization, as well as and ultimately prevents death from COVID. That all persons aged 15 years and above, including pregnant women, are eligible for COVID-19 vaccination. With your support, we are confident that the message of our determination to stop COVID-19 and reduce its impact on our people will reach everywhere, and that you implore the unvaccinated population to complement this determination by taking the vaccines. Ladies and gentlemen of the media, please spread the good news on the need for the vaccine to get into the arms of our people. With a better understanding of the benefits of the COVID-19 vaccines, we hope the unvaccinated population will overcome hesitancy or the fear and take the vaccines. And I believe that today our satisfied clients will also help us convince more people. We are all satisfied clients. I'm one of the people who have had my booster. I'm preparing others to go and take additional boosters if they need to. On this note, I am pleased to welcome you to this press briefing and formally declare the 6th National COVID-19 Vaccination Days campaign fully duly launched. Thank you for making time to join us in this important occasion. Thank you.
Please, let's put our hands together once again for DG. Thank you very much. Let me also remind you that we are live on Facebook, and you can share the link with other colleagues who are not here. Ghana Health Service, if you go live on Facebook, we are there. So share the link with others who are not here so that they can fully participate in this briefing. Let me go over it again. I can see some people writing Ghana Health Service on Facebook. Thank you very much. So as I indicated earlier on, we have support of some of our partners, and they are here to share some few words with us. So with a round of applause, help me welcome Dr. Lisbeth Juma from the WHO Country Office to give us a statement.
Good morning. The Director General of the Ghana Health Service, Dr. Patrick Umabwaje, the Director of Public Health, Dr. Franklin Bekoe, Directors of the Ghana Health Service, the UNICEF representative to Ghana, colleagues from UN agencies, representatives from our partners, USAID, CDC, PATH, JSI, friends from the media, social media influencers, our satisfied clients, distinguished guests, ladies and gentlemen. It's my privilege and honor to bring you these remarks on behalf of the WHO representative to Ghana, Dr. Francis Kasolo. On behalf of WHO and the UN system in Ghana, I wish you a happy and prosperous new year, and may this year and years ahead strengthen our collaboration and resolve to improve public health outcomes for the good of the people of and contribute to the global goal of attaining good health and well-being for all. Ladies and gentlemen, the COVID-19 pandemic continues to rage on, and with the current surge in Europe and the Americas being driven largely still by the Omicron. There is also resurgence in the Asia Pacific, including China, where a record number of cases have been reported. And as of January 2020, A total of 662 million cases with over 6 million deaths have been recorded globally. COVID is still very much with us. The COVID-19 cases in the African region may seem to be reducing, but we are not out of the woods yet. The risk of resurgence due to new variants is very much alive and near our doorsteps, and we cannot let our guard down. As we know, the world is a global village. Ladies and gentlemen, Ghana is one of the countries that has effectively managed to control the COVID-19 pandemic. We have achieved this largely using non-treatment measures, but through prevention measures such as nose masks, social distancing, and hand hygiene. And WHO continues to recommend the use of these measures, particularly the use of nose masks in crowded and closed settings, irrespective of the local epidemiological situation, to mitigate the current spread of COVID-19. Hand hygiene is encouraged, not just for COVID-19, but other respiratory infections, and even more importantly, for waterborne diseases like diarrhea and cholera. COVID-19 vaccination remains core to controlling this pandemic, and we need this vaccination. Why? To protect people everywhere from the disease, to protect our health system, as the Director General has said, so that we can continue providing the essential health services that the system is meant to provide, and to ensure our economic activities continue undisturbed. We also want to restore the health of society and lower the risk of pandemics arising from new variants. These can be achieved despite the intermittent setbacks brought on by the variants, especially where immunity is low. Where immunity is low because we haven't vaccinated or they haven't been exposed, then the likelihood of new variants arising is more likely. Whereas about 65% of the world's population has been fully vaccinated, Africa has only achieved 27 out of every 100, 27% of the targeted population, compared with the Americas that have achieved 71 out of 100. Disparities in vaccine coverage exist in Africa. We have countries like Liberia and Rwanda that have already achieved over 70% coverage, while some are even yet to start vaccination. Where are we? I'm sure we can do better and continue to be the shining example that we have been in public health measures in Africa. Ladies and gentlemen, I wish to express our profound appreciation to the Ministry of Health and the Ghana Health Service for their unwavering commitment to the deployment of COVID-19 vaccines despite competing public health emergencies. We have, as the Director General mentioned, nearly 23 million doses have been administered, with over 31% of the population being fully vaccinated. Even though this is below the target, we know together, if we all work together, we can achieve that set target. Many people are yet to achieve yet to take the vaccine, and it's not that they have necessarily refused or are just hesitant. They are hesitant because they lack information to make the decisions that they can to take control of their health. I therefore call upon all of us, the ministry, the Ghana Health Service, the media, our influencers, everybody who can, to institute a sustained communication and demand generation campaign as we take steps to integrate the COVID-19 vaccination into routine system. We need to improve interpersonal communication to help address information gaps. I would also like to appeal to everyone, anyone, including glad to have our satisfied users here to disseminate information among their peers to everyone in general. This is the surest way to protect our population. I do encourage everyone to get vaccinated. Get your booster doses where these are being offered, and let us be, all of us, be vaccine advocates in our homes, in our communities, in our places of worship, and in our workplaces. WHO and the UN system in Ghana will continue to support our partners and the government of Ghana to respond to all health needs and protect the citizenry against public health emergencies. Thank you all for your attention, and let's do this together.
Thank you very much. Let's do it better for WHO. That was a statement by Dr. Juma representing the WHO country rep. The next partner to give us a statement is UNICEF, and I'll call Mr. Fiakra Makasi, who is the UNICEF country rep, to give us a statement. Please, let's welcome him with a round of applause.
Thank you very much. Director General, the Ghana Health Service, Dr. Patrick Kuma Abuaje, Dr. Franklin Asiedu, Director for Public Health, the Program Manager for the Expanded Program on Immunization, Dr. Kwame Amponsa Achiano, Directors, other directors from GHS here, and GHS staff, my UN partners, including Dr. Elizabeth Juma, representing the representative for WHO, other development and implementing partnerships, including John Bauer from PATH, friends from the media and other distinguished guests, including the influencers we have here today. Good morning again to all of you. I am delighted to be here on behalf of UNICEF and to participate in today's important press briefing to mark the launch of the 6th round of the National COVID Vaccination Days campaign. This round comes just 1 month after the successful Round 5 Vaccination Days campaign, during which around 780,000 Ghanaians received 1 dose of a COVID-19 vaccine, and we trust that this round is going to be just as successful as that one. On behalf of UNICEF again and the broader UN country team here in Ghana, I would also thank the Ministry of Health and the Ghana Health Service for their consistent leadership of national efforts to prevent the spread of the virus and by promoting the importance of vaccination across the country. I would also like to thank the government of Germany, specifically the German Federal Foreign Office, for its significant contribution, which has enabled successive vaccination rounds to take place and to reach so many people. Indeed, it is thanks to such a collective and ongoing commitment among all partners that we can see the sustained progress that is being made in ensuring overall health of children and their families in Ghana. Ghana is also to be commended for its COVID-19 vaccination program to date since the start, once those vaccines arrived in Ghana, where just over now 22 million doses of COVID-19 vaccines have been administered, including nearly 425,000 doses administered in schools. Adults and older children are now being protected against the virus, and this is enabling us to return to a normalcy of life in Ghana, a normalcy in which schools are open and people are back up and running, and they're more resilient to the virus and, of course, other challenges which are facing them. Ladies and gentlemen, UNICEF has been happy to continue to support the government efforts in helping to curtail the pandemic in Ghana. Our support has included the strengthening of Ghana's cold chain systems at all levels across the country, from the provision of vaccine carriers to ultra-cold chain freezers across all regions, to the installation of walk-in cold rooms as well. This work supports not just the safe storage and handling of COVID-19 vaccines, but also and importantly strengthens the safe management and disposal of vaccines in general. UNICEF is also playing a key role in the promotion of COVID-19 vaccination, both in the run-up and during these rounds. As we did during round 5, we will, for example, support social mobilization and monitoring activities related to the vaccination days, including with the support of MTN, sending SMS messages out to about 20 million people to provide information about the COVID-19 vaccination days. UNICEF will also support GHS and partners with traditional and social media coverage, and we will dispatch UNICEF teams to support the COVID-19 efforts across the 12 regions. I'm personally looking forward to traveling to Kumasi and other parts of Ghana over the next few days while the COVID-19 vaccination campaign is ongoing. However, as has been mentioned already, while COVID vaccination rounds continue in Ghana, like the rest of the world, Ghanaians must continue to remain vigilant towards the virus. New strains and variants continue to emerge, including over the past few weeks, and this reminds us that the virus has not gone away. COVID-19 is not yet done with Ghana. And as we all know, no one is safe until everyone is safe. Distinguished guests, with the festive season over, or at least winding down, I think spotted a few Christmas trees still hanging around, we know to expect spikes in this virus around this time of year. So let's all make a New Year's resolution now, a commitment to ensure that we get vaccinated. And we look to the media especially to say the following: protect yourself, protect your loved ones, get vaccinated this week. Thank you.
Thank you very much. That was a statement from UNICEF country rep, Mr. Makasi. Please, let's put our hands together for him. As I stated earlier on, we have some influencers here with us, and they would like to share some few words with us. So with a round of applause, help me welcome Mr. Stephen Mensah to share some experiences with us. Please mention your handles for us and which of the social media you are on.
Thank you very much for this opportunity. My name is Stephen Mensah. I'm a social media influencer and also a student leader. I mostly operate on Twitter. That is the social media platform that I mostly use. And thank you. So with the little experience that I have and the few words that I have to say, before I took my first jab, I was actually scared because of the rumors and then the kind of information that was out there. But then again, I had to go to school, and then I knew very well that before I'll be allowed to enter campus, they would definitely ask for my COVID-19 card. So I had to go and take my first jab. I don't know, during that period too, I had a friend from one of my groups took his vaccination, and then he complained of pains, and then he was sick and all that, which scared most of my peers, and then we decided not to go and do it. But like I said, I had to do it because of school, so I took a bold step and then I went to do it. When I did it, I was actually expecting to have some side effects and all that, but to be very honest, nothing happened. I was very okay, so I informed the rest of my peers that this was my experience, and then nothing happened to me. So we went to the first person who actually did this, and then he complained, and we later found out he was actually sick. He was having malaria, so it led to that pains and then the weakness. That is why those experiences actually came. I've not had people complain about they taking the jab and then having side effects about it. And I think that if you all get vaccinated, it will help each and everyone. Thank you very much.
Thank you very much for sharing your experiences to encourage other people to also get vaccinated. Thank you. So I'll call on the next influencer, but you didn't give us your handles. So please come back.
Sorry, I apologize for that. My handle is _Steve Mensah. _STEVENMENSAH. MENSA. Thank you. Yes, on Twitter and all other social platforms.
Thank you very much. Please let's put our hands together for him. So I'll call Antonia. Please, when you can mention the other surnames for us.
Hello, good afternoon. My name is Tonia Manyaya Muni Azabu. I'm a social media influencer and I mainly work on Twitter. __ Liptonia. So initially when the virus came about, we all scared, me in particular, because the things I was hearing was a bit, scary. But then, God willing, there was a vaccination. And I decided to, take it. But initially, I was having doubts. But my dad was the one who was, pushing us. I was like, if you are the one pushing, you should take it first. And let's see what is going to happen. So he took it. And I think we're waiting for him to drop. But nothing happened. Sorry, but it was kind of a serious something, because you are hearing people are dying and someone is it's a bit scary. So when he took it, he was okay. Then the next to do it was my mom. Also waiting, nothing happened. So I was like, well, I think this is the cue for me to also take it. But when I took it, I didn't have any experience, nothing. I think just the normal pain when you take a jab. So that was the only thing I experienced. And since then, all those who are also having doubts about it, like me, I told them I took it, but nothing happened to me. So I convinced some people, especially those in my family, to also do the same thing. So I'm actually happy there's a vaccination to curb this virus. Thank you very much. Okay, my social media handle __ Liptonia on all social media platforms. LIPTONIA.
Thank you very much. Thank you very much. Before I introduce the next satisfied client, let's watch the video up. It's unfortunate our high table, but they will listen to the sound.
My name is Ajay Ben Raphael. I'm a Uber driver or online driver and also a pastor. Yes, it's true that I'm vaccinated. But before then, there were a lot of rumors around the vaccine and in town. But upon hearing the information from Ghana Health Services, I decided to go for it. And this is my card, and I got vaccinated. At the vaccination center, the nurses told me that the vaccine is safe, and they told me about the possible side effects that I may expect after taking it. And then they made me wait after taking it between 10 to 15 minutes. I did not have any reaction after taking the vaccine, and I feel more secure as I practice other protocols. I advise those who have not taken the COVID-19 vaccine yet to go and do so, because it's safe, effective, and free. So remember, we are not safe until all eligible persons are vaccinated. So protect yourself, protect your family, protect your community, and get vaccinated now.
Thank you very much. Thank you very much. And luckily for us today, we have the TV star with us, the one behind the video. So with a round of applause, help me welcome Mr. Ajay to give us his testimony.
Thank you so much. As earlier on said, I am Ajay Ben Raphael, an online driver or Uber driver. As the COVID came in town, we all know the rumors that followed or that was around it. And most of us were afraid until some of us had the opportunity to receive the information from Ghana Health Service. And as we follow it, I went for the vaccination. And on that same day, I worked throughout without feeling any pains or any side effects. So on the day of the vaccination, I made a friend there. I met a guy who became my friend. The next morning, I called him and I asked, how are you feeling this morning? And he said, oh, all over his body is feeling pain. But he believes that he will be going to take some paracetamol and he will be fine. And I said, oh, I have not felt any pain and I have not taken any painkiller as well. And we laugh over it. So I'm here to testify that the vaccine is safe, the vaccine is free. Let's all go for it. And until the last person is vaccinated, we are all not free. Thank you.
Thank you very much, Mr. J. Let's watch the next video.
Kwenye Lucy Pra Daola Manyo, but a Daola Vivian Family Shibi Committee 18. Me at your Daola, me nami do COVID-19 Mabria. Elevated because Namagbele involved. I'm all in your glossa. I'm at the said a plito over the Mejifipo. Ned Raskin, I see dry macho. Ne enya subota vovova no eme ka kema vas Ghana Health Service to manu kula menya ola eta do vevenye nyembe a vovoma la atikian never do la ele save pa ta bana vado meyelo vado tonye mi komra mele de na so na menya bena madu evola mato le gapopo ya tom magbe la na makpobe nde totro de nava vo tonye me va do vola la record me la totro de que me va after 15 minutes time totro de que me va me ya po mo nam number be ne totro de va ma yo ga ke un kede jinyela me lo ke me va do me mi ano vida ola mi ja gba mi ha mi wa do mi ato fifi lai na makpo mi ma card da.
Thank you very much. Thank you very much. And as I indicated earlier on, likely for us, we have Madame Pra here. Wizolo, she's a bit media shy. Should I bring the microphone to you so that you... Oh, okay, so please come and share. She'll share her experiences with us from the perspective of hairdressers. Please, let's clap for her and give her more of him as she comes.
Good afternoon. Lucy Pra.
My name is Lucy Pra, a hairdresser. A hairdresser at Vivian Farm, Lashibi.
Like the way me COVID-19, me agata me say enuchwa. Abi me va do de. Ma von vie nega Kenya me va do la me po different.
Like the way we heard of the COVID-19 news, I went for the vaccination, and now I was vaccinated.
First, my system la, my tanu na chinue don. I find it difficult to take water, but after taking the vaccine, I'm a vaccine vola. My cover system I change. Me no nachi all right like more than no at least madakuku me ano be hairdresser kata the whole Ghana menesia de need to never take vaccine na at when me.
She said before she went for her vaccination, she found it difficult to.
Thank you very much. Akwe. Okay, so that was a testimony from our social media influencers and also our satisfied client. Thank you so much. We pushed her to come and give the listing because she wasn't prepared to talk. But thank you so much. I think you spoke well. Thank you. So we'll go to the technical presentation and I'll have the honor to invite the program manager, Dr. Kwame Amponsachiano, to give us an update on what has happened so far. The last COVID vaccination campaign were here. He needs to tell us whether we performed or not. So with a round of applause, help me welcome him as our dignitaries are also taking their seats.
Thank you, Jacob. Good morning. Is it still morning? Good afternoon, distinguished members of the High Table, the Director General. Let me stand on the existing protocols. Very brief presentation on how far we've come in terms of COVID. Exactly 6 weeks ago, we're here to talk about the 5th National COVID-19 Vaccination Days. So we'll give an update of that and then look at the whole vaccination in terms of COVID in general. So, yes, the background was given earlier, but I want to reiterate the fact that vaccination is now the mainstay for COVID control or prevention. And we know that vaccine saves lives. And we have a lot of testimonies on that, especially for childhood vaccines. This is the COVID situation as at 15th January this year. We are doing about 2.5 million tests. We've done 2.5 million tests so far. Out of which 171,000 plus have tested positive. That gives a positivity rate of about 6.8%. Currently, as I speak, we have no critically ill person or severe disease, but we have 11 active cases. Unfortunately, we've lost over 1,400 people to COVID. I'm sure this slide is familiar. We keep on updating it as we get cases. So this is the cases by date that a sample was taken, right from March 2020 up till recent times, just about 2 days ago. We've seen quite some peaks and troughs. Essentially, you look at about 5 big waves, but before each big wave, we have some small waves as well. And one of the reasons for us coming about 6 weeks ago was the fact that we wanted to avert a big wave, and we believe that we've succeeded somehow in that, but we need to sustain the gains. So far, we have received over 34 million doses of the different kinds of vaccines we've been giving so far. We still have some quantities at the National Cold Room. Even yesterday, we received some additional 1 million doses. Looking at how many people are left to be vaccinated, we still would be expecting some vaccines. Again, the regions also have vaccines that they are distributing to the district, and as and when they get depleted, we replete them. So this has been presented already in terms of the number of doses that we have delivered. We are doing approximately 22.6 million doses as of now, and the breakdown is what you see on the slide. But essentially, we would say that nearly 30 million persons out of an expected 18.2 million people have come for a vaccine, at least a dose. And that represents about 71% of the expected number of persons who are eligible. And that translates to 41% of the total population. Of these, nearly 9.8 million are fully vaccinated. And that again represents about 54%, which the Director General has already alluded to. And if you translate it to the entire population, we are doing about 31%. Again, a little over 3 million persons, as has already been presented earlier, have come for a booster dose. On the right side, you see the regional performance in terms of persons fully vaccinated, and then the district performance as pertains to our country. And you would realize that for us, the northern parts are doing much, much better. But I would say that over time, we have improved. And the next slide will show us how far we've come. So the greener, the better. And as you can see, we have moved from very light green and yellow to gradually becoming greener and greener and greener. We want all regions to be very, very deep green in terms of this. And then in terms of the districts, very similar picture. But just to say that even within the greens, there are still some light green areas, which we're trying to mop up in terms of getting additional people come for the vaccine. But essentially, over time, we have done quite some improvement. So now, coming on the vaccination days in particular, you will recall that, again, 6 weeks ago, when we made this presentation, we reiterated the fact that the campaigns have been one major strategy that has helped ramp up vaccinations. And you would see from the ones that have arrows that anytime we had a campaign or a day set aside for campaigns, our coverage went up. And so it's come to stay. So right from February, then in April, in June, we did 2 campaigns. And then we had to respond to some other outbreaks. And so we didn't have much time to do the campaign until December last year, when we did a 5th one. And each time we did a campaign, we saw that the vaccination coverage went up. So it's not as if people are not taking the vaccine. They are, except that we need to do a bit more to get those who are yet to decide come for the vaccines. But these achievements have not been without challenges. We know the good old misinformation, disinformation has been presented by the satisfied clients and many other people. Of course, when people don't see the disease, they think that the disease is gone. And so there's always low risk perception when the disease is not going up in terms of our country. But we keep on saying that the best time to get vaccinated is when you don't have the disease, because vaccination is preventive. It is not when the disease is rife that we do vaccination. We do vaccinations when diseases are very low. Again, same healthcare workers have been responding to multiple outbreaks, and it's been quite a challenge for us. So coming home, why are we keeping on doing these campaigns? I think I've made mention of the fact that they work. The campaigns have worked as a major strategy. And as the pandemic continues to wreak havoc on our healthcare systems, we need to re-strategize to save our economy. Also want to reduce hospitalization, especially of unvaccinated people, and therefore we have realized that those who are unvaccinated are the ones who get hospitalized when they get the disease from the data. We also would recall that we had our first 2 cases on the 12th of March, a day after WHO declared a pandemic in 2021. 2020, with our first cases recorded in 2020, our first vaccinations done in 2021. We so know that there are lingering concerns about the vaccine, but all the evidence points to the fact that the vaccines are safe. With 30 million people ever having at least a dose, we know that we have more than enough information about safety and its effectiveness. So we want to show that the NACVATs have worked, or the National Vaccination Days campaigns against COVID has worked. We have done 5, as I've already presented. The 5th one was completed last December, around just before the festive season, in anticipation of influx and gatherings. And as you know, we have managed to avert a big wave, but we need to sustain that, and therefore we want to do the 6th one, which is due for tomorrow, as the DG already mentioned. We are ending on the 24th, but beyond that, we still have the avenue to get vaccinated in the healthcare facilities by way of static strategies. So our scope, will do a nationwide campaign again, targeting the 15-year-olds and above, including pregnant women and lactating mothers. We are using multiple approaches, including the static, the healthcare facilities, the outreaches where we normally go and do the childhood vaccinations, the camp outs, especially on the islands, and of course we send the vaccines close to clients by using modified house-to-house strategies. We are aiming that at the end of the period we would have done about additional 1 million doses. We've normally, before every campaign, we do a lot of activities, including planning, meetings. In fact, the failure to plan, as you know, is a plan to fail. So we always have to plan. Every campaign is different. So we've done planning at all the different levels and with partners as well. We've already sent vaccines and logistics to the regions, as I said earlier. Our communication materials usually have to be updated. We've done that and shared. So our plan is to roll out from tomorrow, and the communication plans have already been started in terms of using the multiple channels. So we are doing the radio, the community information centers, the gong beating, depending on where we are. And then, of course, we'd also use the healthcare workers themselves to go around and do the campaign in terms of mobilization. Of course, with the support of partners, especially UNICEF, for this particular campaign, funds have been secured and shared with the regions. So, by way of timelines, these are the key timelines. The press briefing which we are doing now is today. We did our orientation or re-orientation of our regional teams and the national supervisors and monitors yesterday. Most of them are leaving for the field this morning and this afternoon. Our readiness assessment, usually once we decide that we're doing a campaign, it starts and it's ongoing. We are implementing the campaign again from tomorrow till 24th, and then beyond that we switch back to the static strategy. So in conclusion, I would say that COVID vaccines can do, and we know protects the majority of people from hospitalization and death, and which is why as many doses need to be administered around the world as rapidly as possible and equitably as possible. The National Vaccination Days against COVID have shown to work as an effective strategy for improving COVID-19 vaccination coverage within a short time. Of course, we know the role that the media plays and continue to play in the success of these campaigns. Distinguished ladies and gentlemen, I rest my case. Thank you very much.
Thank you very much. Let's put our hands together for Dr. Kwame Amponsah-Chiano. I'll invite our dignitaries to take back their seats up here so that we can continue. Whilst they are taking their seats, the floor is open for your questions and contributions, comments. So let me see by hand if you have any question so that we can give you the microphone. Let me start from my right. This row. Please, do we have any question? Oh, okay, I'll come to you. Okay. Left. I saw a hand. Yes, please. So, introduce yourself, then you ask your question.
Hello, my name is Philip Ofori Yabua. I work with Obuoba FM in the Eastern region. My question is, looking at the previous fifth edition of the campaign, it was somehow a bit lengthy, but the sixth one, starting tomorrow to 24th January, I see it to be very short. Isn't that so short?
Okay, so you are looking at the duration of the campaign. Okay. The program manager and DJ will respond to that. Do you have any more questions? Okay, so I'll hand over to PM, then DG can top up. Okay, there's a hand there. Let's take that one. Doc, let's take the last one.
Yes, I would like to find out the areas where we are having hesitancy, persistence after the fifth editions. What new strategies is the program?
Thank you. There's another hand.
My name is Linda. When the WHO rep was speaking, she mentioned steps to integrate the COVID vaccination into the routine immunization system. I would like to know if we are considering that in Ghana and
Thank you very much. Is there any more? Okay, Dr. Chiano.
Yeah, thank you very much. So the first one is about the duration. Yes, campaigns are very tasking, and yeah, thank you very much. So about the duration, as I said, campaigns are very tasking. It's very, very tedious. So normally we don't do campaigns for a long time. It's usually 3 days up to about 7 days. So for this one, it's 5 days, and we think that is fine. Otherwise, we would end up with tired healthcare workers who would not be able to carry on the other routine activities. And mind you, it's not only COVID we are doing everything, HIV, malaria, measles, and all that. So, and it's the same healthcare workers. So we give a brief period for that. It's called the periodic intensification, then we move on. Additionally, for this particular one, no, if the fifth NACVAD we did for 5 days as well. And so it's not too different. And normally it's 5 days, 7 days, 5 days, 7 days from experience. Again, for this particular one, we're also going to do a special school-based campaign, which will come very early part of February. So normally you give some period for respite so that healthcare workers can rest a bit and then they will carry on. So that's the rationale for this. Oh, okay. Okay, so public notice, yes, yes, yes. I agree with you, but you know, we've just come out of Christmas festivities, so we needed to balance the holidays and everything else. That is the reason why probably we have a shorter time. But with support of partners, for example, UNICEF and WHO, we already are doing the text messaging and all that. And it's all part of the social mobilization. So we've already started. The second question was about which places are the hesitancy and all that. Okay, so if you looked at the map carefully, you saw that the southern portions, especially southeastern part, where are those places that we've over time struggled to get to green. I would say that there's been a lot of work done, and some of the strategies are that in some places, we realize that the fetish priest played a big role in that. And for this time, the healthcare workers and the social mobilizers are in touch with them. So that's a different strategy. So once they give the go ahead, you know, the vaccination will go on. We didn't realize that at first. So it's over time that we are realizing that there are some key influencers in the community that we probably haven't identified. So those are some of the strategies. Identify new influencers, community opinion leaders, and so on, and then targeting them. Then the final one is about integration of COVID. I think in my presentation, I even made mention of the fact that once the campaigns are over, we'll go back to. So in a way, it's more or less integrated, except that we need to define our integration well. So we have been in touch with partners and looking for support so that COVID-19 will become part of the routine immunization, because we know that is where we are going. This time to be for adults. So adult routine immunization. So those are the issues I picked. I don't know whether I missed anything.
Thank you very much. Before we take the next round, let me introduce Mr. Bright Amisa, who is the coalition of NGOs, our chairperson. Thank you for coming. Do you want to share some few words with us? Please, the floor is open for you to share some views. So please, let's welcome him to share some few words with us.
Thank you very much, Jake. Mr. Chair, all protocols observed. Good afternoon, colleagues, ladies and gentlemen. We are happy from the front of the CSO to be part of this very important launch. We have always been part in the 5th round. We also took the opportunity of working in about 3 districts. Accra here, Tema Metro, and part of Eastern Region. And all the stories that were shared are the truth. You go and then you get to know that people are ready sometimes to take the vaccine, but we are not reaching out to them because of time. This time we, the coalition, mounted vans. So we did what we call the float, where we went through town with van announcements and mobilized a lot of people to do the shop to shop, door to door, house to house, with vaccination teams following us. And it will shock you to notice that we vaccinated over 17,000 people. So, Doc, we are also saying that after this campaign, we'll also do a 2-day mop-up just to add on to the time, the campaign time, and sweep. So we are doing the sweeping method. Others might be busy doing their own things. So we follow after the campaigns, and then we also catch them. And a lot of people continue to avail themselves for these activities. So our team are also there in most of the districts doing the announcements and then mobilizing in support of Ghana Health Service. So we get better results for this campaign. So we are very optimistic that our 1 million is going to be reached and even beyond, and we will continue to support that cause. Thank you very much.
Thank you very much, Coalition of NGOs, for your continued support. So go back to DG before I come for the next round of questions.
Thank you. I just wanted to add something to the first question, that apart from this national launch, we also have the regions doing their own launches. Some of them have been on radio and local radio the last 1 week, advertising and prompting people that's going to happen. So I believe that that's what's going to happen. On the hesitancy, if you see the graph Dr. showed with the Ghana maps, you see they're getting greener and greener. And the strategy, which means that it's working. Advocacy and this behavior change doesn't happen overnight. So you have to continue doing the same things to ensure that people change their behavior. In some places where we had issues, we actually, in a short time, use our own MPs to go back to them and also talk to them. And it also shows some results. So we will continue. It's working, and with your support, I believe that we can reach all people. For the routine immunization, it's only routine that we cannot be in this campaign mode forever. So we have to now mainstream it into the existing immunization system. And we know the advantage is that these are people who have been vaccinating children and people who have confidence in them. Yeah, the mothers go with their paracetamol as soon as they get the vaccine and they don't have a problem. So we believe that there are people who are close to the people and they might be more confident in getting their jobs from them. Thank you.
Thank you. We'll take the last round of questions. Please go ahead.
Please, I want to find out from the service if it's following up on the development around the Boko enclave with the Burkinabes trooping into the country. I want to find out the healthcare workers who will be doing the immunization exercise. Is there any new way they'll be going about it, or it's the same routine way? And I also want to find out from DJ, you said during the COVID we tried as much as possible to ensure other essential services were not left out, but for some time now we've been having complaints from some people with regards to the routine immunization, that some of the vaccines were not available, like the polio and all that. I want to find out if the service is aware of this and what it's doing about it. Thank you.
They want you to be here so that you can.
So, yeah, thank you very much. I believe this is one of the challenges of when these conflicts disrupt health services. Obviously, the regions are going to do an assessment to see how safe each community is. Where they feel it is inappropriate to do vaccination, they will not go there. So that's what will be the regional's assessment, and usually the district security group will advise whether this is an area you can go and vaccinate. So these are some of the challenges when we have these disruptions affect everything, and so there are areas they may not be able to go. Essential services, I think when we talk about essential services, we are talking about routine, immunization, maternal and child health services, among others. And you could see from the data that despite all that, we're able to keep things afloat. I think immunization dropped by just about 2%. We are experiencing some delay in acquiring some vaccines, and we are working frantically with the ministry to make sure that the needed vaccines are brought in so that we continue vaccinating people. Thank you.
Thank you very much, DG. In the absence of any further question, we'll go back to DJ. DJ, I'll invite you again. So that so I'll invite DJ again to formally close a press briefing. Please let's welcome him with a round of applause.
I think we've had a brief but a very wonderful launch. And we are grateful that we are all here. This is the 6th launch. People would have thought maybe it's getting boring, but I believe that it's still getting more excited. That's why we still have people here to make sure we are able to reach. This is a very important exercise. It's a practical approach that has helped us increase our coverage in a very short time to cover as many people as possible. The African average, as said by WHO, is about 27%, which means that Ghana's coverage is, by African standards, very high. But I believe that Ghana's standard is different, is that we want herd immunity. And so we're going to continue, and with your support, social media people, certified clients. I'm also a certified client. Because I bought 2. Yes, when I took my booster, I felt sick, but that's normal. That you take something and you may feel weak, tired. Some may not. Doesn't mean that didn't work. So, but I'm here, isn't it? And if I get opportunity, if it's appropriate, I'll take another one. So we want to thank you all, the media, for being with us, our partners for always being with us, providing both technical and financial resources for us to carry out this important exercise. So let's go out there and make sure that even those of us who are here who have not, I know there are some people here who have not taken their second dose. Not even the booster, please. Go and take your second dose. As for the first, I think all of you have had it. But there are some of people here I know who have not taken their second dose. Go and take your second dose. Take your booster and make sure that you stay safe and protect all of us. Thank you very much, and I wish you the best. So, thank you.
Thank you very much. Thank you very much. That was the closing remarks from DG. So the date is 20th to 24th of this month. Let's encourage each other to go and take either the first one, the second dose, or the booster. Thank you once again for coming, and we hope that you are going to carry the message to those who are home and are yet to be vaccinated. So we'll take the closing prayer. Auntie Nelly, please close us. Let's welcome her with a round of applause. Madame Nelly C.
Thank you, Jacob. Please, shall we pray? Yes, my Lord, I give you all the glory for answering our prayers. We called upon your name from the beginning, and indeed over us and brought us to a successful meeting. As it is our prayer that your Spirit continue to go with us, continue to strengthen us, continue to impart your knowledge on us. As I place the media before you, as they go back, they should go and spread the message far for everybody to hear. Not only hearing, but to be able to do what the message is expected to do. We thank you, Jesus, once again. Pray for travel message to our various offices. Glorify your holy name. May your name be praised through Jesus Christ our Lord. Amen.
Amen. Thank you very much. Pack lunch will be served outside, so please. Hello? Yes, so we'll take a group photograph here. High table, we'll take a group photograph with you. So please, yes.